approved the congestion pricing plan. So it's a long list.
How important on the list is congestion pricing?
They're all important.
Governor, in the spring, we had problems with supplies and staffing, and you talked a lot about nurses from other places. Those folks are not available now. What concerns do you have about staffing and supplies? And where do things stand now, specifically on Staten Island and the city in general and the state?
Supplies, we had, the spring was a case of first impression, right? Nobody knew where we were, and we were improvising every step of the way. As I've said before, and as a cathartic process wrote in my book, that we had SARS, MERS, Ebola, dengue, Zika, H1N1, and then we have COVID, and this nation was surprised that we had COVID, is still incredible to me. Dot, 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 just factor out the dots. SARS, MERS, COVID, all coronaviruses, all from China, all from wet poultry markets, all evaded the national health gurus, and then COVID travels from China to Europe, is in Europe for 3 months, nobody knows it, and comes here from Europe for 3 months. Anyway, so it was all a case of first impression. PPE became a major issue. Masks, gowns, testing, reagents, staffing, next. We have learned our lesson. We have the PPE that we need. We have the supplies that we need. We have the surge capacity now in the hospital system. We're using it on Staten Island. This is surge capacity, which we never used in the spring, but now we need to use it on Staten Island. Did we ever fill Staten Island in the spring?
The hospital system?
No,
Or that's,
the South Beach facility.
we had about 200 patients over the period of the...
In South Beach?
In South Beach, yes.
Okay.
But these are
So-
COVID convalescents, people who were recovering.
All right, so we're reopening that emergency facility. So we have the surge capacity, we have the PPE. The staff, one of the problems with the staff in the spring was they were burned out. They were working 7 days a week, and they were burned out. And they were sick. We've identified additional staff people who can work, but we don't foresee that dire logistical crisis that we had in the spring. What you can't deny is hospitalization goes up to 6,000. Hospitalization is a nice way of saying more people die, right? More people die. We had 1,000 people in the hospital 3 weeks ago. 3 weeks from today, we can have 6,000 people in the hospitals. 3 weeks ago, death rate was about 10, 15. Today it's about 33. If you're at 6,000, you could be back in over 100 deaths.
Governor, can you clarify how schools can test out once they're closed in an orange? You said they can test out and reopen, but what's the threshold there for a school? Do they have to have, what's the specific testing rate? And along those lines, how quickly could schools in New York City reopen if they do adapt that testing?
Yeah. Remember, Andrew, we did this 2 weeks ago. We had the Brooklyn zone. Brooklyn went to a red zone, I think it was, and Queens went to an orange or a red zone. But schools closed in those zones, and what did they do? They closed for 4 days, cleaned the schools, test the students. Any negative student can return, positive student can't return. And then 25% of the student population is tested once a week. And on that basis, the school reopens, which happened in Brooklyn. For some schools, not all schools.
In this case, because of the mayor's 3% threshold, is it a case of them needing to just renegotiate the threshold, then put in the testing protocol, and they can reopen in a matter of days?
No. Apples and oranges, okay?
Are you coordinating with Mayor de Blasio, though, about his phased reopening? Because
Yes.
I feel like there's been a lot
Yes.
of...
No, there hasn't been. Let's just be clear, because there are facts, okay? So let's just know the facts. Education, and we did this yesterday, but not everybody was here, because you don't work Sundays. I work Sundays, because I get overtime on Sundays. Time and a half, actually. The education has historically been a locally controlled issue. And local governments are very proprietary about education. You get outside of New York City, you go to buy a house in the suburbs upstate. You don't say to the real estate broker, I want to buy a house in Mount Kisco. You say, I want to buy a house in the Chappaqua School District. I want to buy a house in the Scarsdale School District. So the school district, school board elections, school superintendents, it's a very intense. They wanted local control over the schools, which is what normally happens, subject to state regulation always. 700 local school districts. I said, this is what we'll do. You have local control up to 3%. When 3% happens, the state law takes over. But up to 3%, it's up to you. So some school districts have hybrid, some open, some closed, some do remote, some do a combination, whatever the parents wanted. The one thing I insisted on was I said, consult the parents and the teachers. I don't want the school superintendent to make a decision and then the parents say, that's a crazy decision. I'm not sending my students, my children. So up to 3 is up to them. Once it hits 3 on the state's numbers, because local governments have different numbers, once it hits 3 on the state number, now it triggers orange zone. Above 3 is red zone. Once it triggers orange zone at 3, state law kicks in. And state law is the school closes, I believe it's 4 days. 4 days, clean the school, you can test and reopen. You have to test every student on the way back in. If a student is negative, they come in. If a student is positive, they can't come in, and then you test 25% of the population. Under 3%, if it's not in an orange zone school, it's totally up to the local government.
Governor,
Excuse me a second. Over 3%, it's not a union negotiation. I'm not negotiating with the teachers' union. Mike Mulgrew is the New York City Teachers Union. You then have local teachers' unions all across the state. The way you have a Mike Mulgrew, there's an Andy Pallotta who's the head of the statewide, and then there's Rochester teachers and Buffalo teachers and Nassau teachers and Suffolk teachers, multiple unions. The same rule applies to all at 3%. This is what happens. Bing, one rule, one law across the state. Under 3, it's up to that local school district, it's up to the city.
Governor,
Is that clear?
on Thanksgiving,
Yes,
the
sir.
10-person rule, upstate law enforcement and upstate politicians have said it's either impossible to enforce or we refuse to enforce it. How do you react? How do you enforce the 10-person rule? Also, congratulations on the International Emmy. Your reaction to that as well,
Thank you. Let me write this down because those are two different things. Yes. That's the underlying point of this discussion. You have this is an emotional time, political time. Everybody has their own strongly held opinion, right? You have a strongly held opinion that says COVID is all an overreaction, it's a hoax, I'm not wearing a mask, I'm not following these rules. You have sheriffs upstate who have said, I'm not going to enforce the law. Now, how a law enforcement officer says, I choose not to enforce that law, I believe that law enforcement officer violates his or her constitutional duty. I don't consider them a law enforcement officer because you don't have the right to pick laws that you think you will enforce, and you don't enforce laws that you don't agree with, right? That's not a law enforcement officer. That's a dictator. So you're not a law enforcement officer. You can't pick and choose. And if that's the way you run your law enforcement agency, I don't consider it a law enforcement agency. So God bless you, but don't ask me for help. And I think it's a dangerous precedent. Police officer says, well, I don't think cocaine should be illegal, so I'm not going to enforce the cocaine laws. It's not up to you. You don't have that right. But it's signifying, because the upstate sheriffs, what they're doing is they're being political. The no more than 10 rule, people find intrusive. You're telling me in my house I can't have more than 10 people? It's none of your business what I do in my home. Now, of course it is. Laws apply in your home. Domestic violence applies in your home. Drug laws apply in your home. Yes, it does. Well, I'm going to celebrate Thanksgiving the way I always celebrate Thanksgiving, right? People on Staten Island. We're having the same big family Thanksgiving that we always have. And nobody's going to tell me not to have a big family Thanksgiving. I'm telling you that you are responsible for your actions. And here are the numbers, and the numbers don't lie, and this is the increase before any other increase from Thanksgiving. And if you increase social activity, then you're going to see the number go further up. I said to one person, I had a conversation with somebody on Staten Island, who said, I'm not following these rules, they're all baloney. I said, I'll make you a deal. I will exempt you from all the rules. You agree, if you or anyone in your family gets sick, you're purely responsible. He said, what do you mean? I said, if you get sick or your family gets sick, you're responsible. You stay at home and get better. If you have to go into the hospital, you pay the bill. You find a nurse to take care of you. You find an ambulance driver who wants to drive a COVID positive person to the hospital. You're responsible. Well, no. I'm not doing that. I said, oh, see. So you want to be able to act irresponsibly, but then endanger the ambulance driver, and endanger the nurse, and endanger the doctor, and endanger the 1199 member who has to come and change your bedding because of your actions. It's not like your actions only affect you, right? You act irresponsibly, you get sick. Now, 30 people are affected because you are infected, right? But there is no doubt that is an undercurrent, and it's in the numbers. The numbers are reflecting the behavior. You look at the areas where the sheriffs say, I'm not going to enforce it. You look at their infection rates, some of the highest infection rates in the country, in the state. You look at the communities in Staten Island that say, I don't believe this is true. They have the highest infection rates in the city. Was that a coincidence? Yeah. On the Emmy, when I first heard, I was flattered by it, but then I looked into it a little bit. Oprah Winfrey won it. Steven Spielberg won it. Al Gore won it for Inconvenient Truth, which I thought was just masterful. It is flattering, but it's also symbolic. I just watched it before we came down. For it to be personalized to me, I want to make sure people understand that I'm just the symbol of a much larger effort. The people who are around this table, who Rob, Melissa, Gareth, who were there every day, every public employee who was out there putting the numbers together every day, and really the people of the state who made it work, right? What they were saying on the presentation was, I gave facts. They never mentioned my sense of humor, by the way, nor did they mention any charisma or good looks or charm. They didn't mention a lot of things, but they said I gave facts. But it's that New Yorkers responded, and New Yorkers did respond. And that's how you go from a 50% infection rate to a 1% infection rate. And now you're at a 3% infection rate. And by the way, the parts of the country that didn't have it in the spring, they're now at 50% infection rate. Wyoming, North Dakota, and we're one of the lowest. It was really one of the most beautiful, effective exercises of social action, right? We did this first in the nation, first state in the nation to have a mask mandate. We're like 99% compliance with masks. Why? Because I made it a law? No. Could never ticket. You know, I think we gave out 10 tickets. New York City, all they use is sheriffs now. It's not that we give tickets if you don't wear a mask. It was just social action, social behavior. People accepted it. That's what the Emmy's all about. It was beautiful to see what people can do at their best, how they can come together and how they can sacrifice and how good they can be, especially in New York. All the diversity, black, brown, gay, straight, LGBTQ, all this diversity. It's a problem everywhere else. Differences, differences, differences. No, commonality, commonality, commonality. That's what New York said. That's what won the Emmy. So congratulations to New Yorkers, which I've always said, because it's New Yorkers who did it. Let's take one more.
Governor, the head of what measures
I will do more than one more, I'm sorry.
Can you talk about what measures the state may be taking in the of belt tightening in the event that a federal stimulus comes out that doesn't include aid for states and cities, and could that even include maybe even job cuts in the public sector?
If the federal government does not provide relief, state and local aid, belt tightening, it would be going from a 42 to a 29, okay, to stick with your analogy. I don't really know the relevance of that, but it sounds good. 44 to a 29 waste. You would have to do tax increases, government cuts, and borrow, and layoffs, and you would still have a long-term issue. You'd have to do all of the above. Let's say the number's about 50 billion.